I'm very happy today to have as a guest at Karmayogi Talks Dr. Randeep Guleria. Dr. Guleria, as you all know, is very well known for all the work that he's done in the country and especially during the pandemic. A little bit of introduction on him. He is the chairman of the Institute of Internal Medicine and Respiratory and Sleep Medicine, and also director of the Medanta Medical School. We all know that Dr. Guleria is a distinguished pulmonologist, a former director of the All India Institute of Medical Sciences, Delhi. He has a career which has spanned 3 decades, and he has made significant contributions to pulmonary medicine, critical care, and especially pandemic management in India. Dr. Guleria is a Padma Shri 2015 and has also received the Dr. B.C. Roy National Award and the Lal Bahadur Shastri National Award for Distinguished Service and Excellence in Medicine. Beyond clinical practice, Dr. Guleria has played a crucial role in shaping India's healthcare system and played a very critical advisory role, both when he was at AIIMS as a director and after that as well. He has worked extensively with international bodies like the WHO and CDC. Most importantly, as a trusted public health voice, he has actively engaged in awareness campaigns, policy discussions, academic mentorship, enforcing his commitment to a healthier India. Welcome, Dr. Guleria. Very happy to have you.
Thank you very much. Thank you.
So, Dr. Guleria, let's go back about almost now coming up to 5 years and a few months of COVID. And I had the privilege of knowing you then and in some capacity working with you as well. The question for you is, COVID and your role as director of AIIMS induced a lot of competing pressures from several stakeholders with whom you were working, perhaps 24/7. So my first question is, how did you prioritize these competing claims on your time and more particularly on your leadership, on your decision making?
So first of all, thank you for having me on Karmayogi mission, and it's indeed an honor. COVID-19 was a big challenge for all of us. And I think during that time, for the health community, it was a big responsibility, if I may put it that way. So while I was there as the director, we realized that we are going to have a pandemic because we were already having this news coming out from China of an outbreak which was causing a lot of hospital admissions, and there was this fear of a new virus which had been reported by WHO. And of course, then there was this data that this virus was spreading. It had spread already to Europe and to Italy, and already the government had started measures to contain the spread by a lot of screening at the airports. But one understood that at some point in time, it was inevitable that the virus would enter our country because pandemics are like that. You can't stop them for long, even if you do a lot of screening at the airports or point of entry. So we realized that anything that aims that we will have to really have a lot of teamwork together. Everyone has to work together. And for any pandemic, we have to look at how can we have a quick response at a large level. So how do we involve not only the leadership, but people who are going to work at ground level, the people who are the residents, the nurses, the technicians, and public health experts, because this is not only going to be limited to the hospital, but you're going to have awareness even in the community. So that started as a process of trying to interact with everyone, forming different committees and groups. And I started having a meeting every day in the morning. And I had that for almost 3 years with the entire staff, and everyone was invited. And we started off in what was the boardroom. And ultimately, we landed up doing this meeting in the auditorium because the number of people were very large, and there was always the issue of having physical distance being maintained because of the fear of the infection spreading. So there was an issue of getting everyone involved, at the same time being up to date with what is happening, and then balancing that out with, like you said, multiple pressures that are there, because we are living in a time where there is a lot of influence by social media, and there's a lot of sort of information which spreads from one person to the other through the internet, through the phone, through various messages, which sometimes can create a panic. So the issue was, how do we really get things going, but at the same time don't create a situation where people start going into a panic mode, which can lead to more problems in terms of healthcare management. So I think those were the challenges, and we tried to really involve everyone, get more information, data, because it was an evolving health emergency. Every day you were learning something new about the virus. You were learning something new about how the virus was mutating. You were learning something new about what drugs may be effective or what drugs are not effective. And the fact that this virus can have multiple effects, not only as far as the lung is concerned, but it can affect various other organs in the body. So I think there was a lot of challenge in keeping yourself up to date, trying to manage the hospital, and of course coming out with policy decisions, guidelines, and also being able to then inform people in terms of what should be the ideal thing that can be done in terms of managing this outbreak, not only at a mega level, but at a micro level also.
Right. So, I'm wondering, when you were briefing your staff and meeting people, and then all the information that was going out into the country, the two things that one always looks for in a leader who's in the middle of a crisis like this is communication and also empathy. Um, and the fact that you may be having questions and anxieties of your own would not surface when you were communicating with your people. How did you keep that balance of communicating what was required at the time, at the same time also addressing the fears and the panic and the uncertainty that all the people around you would be facing, would be feeling?
So that's very true. This was a huge challenge because you have to be able to communicate, proper manners, so that people have that fear of that feeling of confidence that what they're doing is something that there's a lot of support from behind, in terms of the fact that they are working in an area where they're worried about infection. And this was more true because there was a fear of the infection being carried by them to their other family members and near and dear ones. So a lot of people worried that, if I get the infection, if I go home and I spread it to my parents or grandparents and they get it, then they will have a more serious problem. So what should I do? And I still remember that when we started our first ICU, we were making it and we were doing all the revamping. And this was during the lockdown, that I had this team of residents, and I had one resident who was an anesthetist. And she said, I am going to work here, but I'm the only daughter of my parents. And if something happens to me, who will look after my parents? So you had to really assure all and everyone that, we are there not only for you, but for your whole family. And we will do whatever is needed in terms of creating beds, in terms of providing support for your near and dear ones also. At the same time, you also have to work in a way that everyone does his duty diligently, and it's not that panic creates a situation where you're not looking after the patients when it is required to be done, as far as the patients are concerned, as far as ethics are concerned. And at the same time, you're also building up that confidence as the pandemic evolves. It started off with a fear of the unknown, then the fear of that it's going to cause more deaths, then the huge issue of requirement is of oxygen and medicines, shortage of certain medicines, because there was a huge issue that you should give remdesivir, tocilizumab, or other drugs. And there was also this issue of availability of these medicines at some point in time. So inspiring confidence that yes, all of this, there is a plan in place of trying to get all of this done, and we'll have everything in place. There was a time when I remember we were looking at, even in the early days, shortage of N95 masks and even PPEs. And we even did a project where we saw that we could even recycle PPEs, that if the PPEs was not torn, the gown that one was looking was not torn, you could sterilize it again in-house, repackage it, and you could reuse it, so that if there was a shortage, you could still have PPEs which were properly clean And we actually started doing that at AIIMS, but we didn't need to do it because then a lot of the PPEs were being made in our own country, and we did not have that shortage both for masks and for PPEs. But in the early days, there was a lot of fear that a lot of these personal protection equipment are coming from outside, and because of restrictions and because each country was sort of trying to keep things inside only, we would have a shortage. So there were challenges at each stage, which was both in terms of infrastructure, both in terms of equipment, both in terms of what we needed, and both in terms of human resources, because you had to manage with the same amount of human resources.
Yeah.
You couldn't hire new people, you didn't have new people coming in. So your staff was the same, but the burden of disease went up significantly. And at the same time, the fear of the disease was also there. And the other challenge that we had during this time is that other diseases still continue. So you had a pandemic, but you had a responsibility of managing the non-COVID cases, tuberculosis, cancers, heart problems, diabetes. So how do you balance that out when you have a lockdown, when you have OPDs which are shut or closed, patients are scared to come to the hospital, yet they have these chronic diseases, and you're worried that if they get COVID, then it'll create more complications. So trying to balance that out was a big challenge as far as the health system was concerned.
So one last question on COVID, and then we'll move on. So when we look back, Dr. Guleria, on those harrowing times for all of us and for the medical fraternity in particular, what are some of the lessons you think we have learned from the management of COVID that we can, take forth into preparedness for something like this coming again?
I think there are a lot of lessons that one has learned. One is that yes, we need to be more independent, and we now must have strategies that we can manage outbreaks on our own. We don't have to rely on anyone. So we have to be Atmanirbhar, if can use that word. We have to develop our own resources. We need to upgrade our tier 2, tier 3 cities, because we have a lot of good health infrastructure in terms of tier 1 cities. But as you go to smaller towns, you go to rural India, you have a big challenge there, and therefore we need to work on how do we improve our infrastructure there. We also need to really understand, and this is something that COVID taught us, how can we use technology in healthcare in a better manner? Because during COVID we started off with Arogya Setu, then we had our COVID app, then we started the teleconsultations, and both for non-COVID cases, and then when home isolation came in, we were able to manage patients at home by teleconsultations and monitoring them. I think those are things which we can even continue to do, both for future outbreaks and in terms of how we can strengthen our outreach as far as health is concerned. There's also a very important issue of public health education. We need to educate the public in terms of health behaviors and how they can improve things so that infection control becomes better. And I think the biggest lesson was, how do we handle the infodemic or the social media, which creates sometimes a panic? How was one able to give reliable and good or acceptable, scientifically evidence-based information out there, so as not to create a panic? Because that was also something which happened. And like I said, we need to be self-sufficient, not only in terms of let's say the equipment, but in terms of research and developing new things. India did phenomenally well in terms of getting the vaccines there. We had 2 vaccines, and subsequently we had almost 6-7 vaccines which India had approved. And that really made a big difference. But if we had to rely on vaccines from outside, we would have had a problem. So similarly, in terms of equipment and research into developing new vaccines, new drugs, all of that is something which we need to continue as we move forward, because we are going to see more outbreaks in this century. We've had 2 pandemics in the last 25 years, the swine flu H1N1 pandemic and COVID-19. And we keep hearing of outbreaks now. Off and on, we had this monkeypox and other outbreaks. So we should have a good surveillance system, some degree of plan in place, and be self-sufficient so that we can manage things on our own.
Yeah, it's interesting, you bring up the vaccine factor, because We've also seen a lot of hesitancy when it comes to getting the vaccine. And as you said, being educated about it helped. But in from the past, one of the things I wonder about is how to make sure everybody in time is ready for vaccination. What is it that compels some people to do it and others are reluctant because of what they've heard and its side effects? And how do we get past that hesitation and make sure the entire, public makes sure that they take the vaccine?
I think that is very, very important. If we look at data, vaccine is one of the most important things which has helped in infection control. It is second only to safe drinking water. And vaccines has helped us eliminate two diseases from the planet, smallpox and polio. And that has been eradicated from the planet only because of the vaccine strategy that we had. Smallpox vaccine in the 70s, and more recently, the polio vaccine. So we've been able to eradicate these infections. Therefore, the importance of vaccine cannot be undermined. But along with that, one has to understand that whenever we have a vaccine and whenever we have a drug, it is going to have some degree of side effects, but they are very minimal, and one should not sort of hesitate about taking vaccines. After all, I think every day millions of children get vaccinated during infancy, after birth, which has really decreased infant mortality to a very large extent. That has only happened because of a very good immunization program. So if we say these vaccines are good and we're using a similar platform to make newer vaccines, then the only way in the future to be able to control outbreaks is vaccines. But there is a lot of vaccine hesitancy. And like I said, that it's very important to really have good public health education about the importance of vaccines, how they help. And now, especially, the focus has to shift not only from vaccines for children, but what I would say is a life cycle immunization, vaccines for elderly, vaccines for people who have comorbidities. That will help in decreasing the burden of disease. And these are preventive strategies which can have a huge impact as far as health is concerned. Therefore, pushing for an aggressive vaccination program across lifestyles, whether it be pregnant women, whether it be people traveling to crowded places, people whose immunity is low because of various problems that they may have, heart disease, diabetes, cancers, or for individuals who are elderly, vaccines are something which are very, very important. But we need to really put the information out there, become vaccine, push for good vaccine advocacy, and be able to counteract the fear that people had. I remember many years ago when were visiting places, people said that people are reluctant in one area to take polio drops because they felt that this will lead to sterilization. This is going to cause problem in terms of fertility. So you will always have this thing, and it's very important to get people who can influence the public, social influencers. It could be religious leaders, it could be others, to push for the vaccine program and build that confidence that vaccines are safe, and show the data that so many million people have been vaccinated and without any problem. That really will help. So we have to counteract the misinformation that goes through in social media.
And Dr. Guleria, when we look at our public healthcare system, which an emergency like COVID glaringly brought into full view, what, in your view, are some of the gaps in our public health system that make handling a health emergency challenging? And where are these gaps that we can start to fill them so that we are better prepared?
So there are gaps which we need to look at. There are four broad areas that I could first think of, and then I'll expand later on. One is awareness. We need to have a lot of awareness in the public in terms of the importance of preventive measures. That is very important. Second is access. We need to have a strategy of how can we really provide access as far as healthcare is concerned, especially when an outbreak happens, to every part of the country. That is even remote areas, because the infection will spread all over. So the access available has to be there. The other challenge that we had is the absence of manpower and resources. So we need to develop a strategy. How do we develop ways of increasing our resources and manpower when we have an outbreak without too much of strain on the already working system, which has to manage the non-outbreak diseases also. So, strategy of how do we sort of structure our, let's say, infrastructure, resources, so that we are able to balance the management of the outbreak without causing a lot of disruption to healthcare otherwise, because that is itself a big challenge. So, the collateral damage which happened during the pandemic to the non-pandemic diseases is something that we also should keep in mind, and that is another thing that we need to develop strategy. And finally, we need to develop strategies of affordability. How can we make everything affordable? Because cost comes in a big way in terms of time. And that is why if we have a lot of things that we make in-house, that will make a big difference. Even when we looked at testing, the initial RT-PCR testing, because kits were coming from outside, was very expensive. When one started making these kits locally, the cost came down dramatically. So when we are able to do that, that we have some things that we need for an outbreak made in-house, it becomes more cost effective. And then, of course, we have to also develop a good pillar for research so that we are able to pick up an outbreak early in terms of surveillance and have that data there, and therefore have a containment policy in place so that we can contain this outbreak, and also have research into developing a vaccine early, developing the drug early, so that we are able to not only contain it non-pharmacologically, but pharmacologically also with vaccines and drugs.
In the many decisions that you had to make in that in an emergency like COVID or any others that will follow, there's a big emphasis on resource allocation. How do you, as a leader, decide what is important? Where would you put your resources? So how do you take a call in prioritizing this resource allocation?
So this is a very difficult decision and very difficult question to answer, because it has something which evolves. And sometimes you have to go by what is the most important thing and what will be most effective in saving lives. So you need to look at how can you use your resources to the best ability, so that you can provide maximum care to patients. And sometimes it may seem a little bit uh, unfair to certain groups, because you are not giving them the resources they're demanding. But if you look at the greater good, then sometimes that is something that needs to be kept in mind. And if you are able to explain this to people, and that I think is why you should be open about, if you're allocating resources, why are you giving it more to one area as compared to the other? If you can explain to them that, look, this is the bigger need, this will help in a bigger way, and that is why this resource needs to go more, whether it be equipment, whether it be disposable. Because sometimes what happens is you are looking at situation where it's the emergency department, where it's the ward, where it's other areas where people are managing patients, and then it's, let's say, non-critical areas. For each individual working in that area, for him, his resources are the most important that he should get. So it's often good to step back and look at the entire picture, and then be able to say that, this is where it'll give the maximum benefit. This is where it'll help patients the most, or it'll help the health system the most. And then let's balance that out. Yes, I do agree that times you have to do a course correction. Your initial assessment may not be totally correct, and you may have to. So there you should be able to also be constantly assess how things are, and how you can sort of reassess what you need to do, because outbreaks and pandemics keep evolving. Today, what you need may not be relevant what you need tomorrow. It's for drugs also. You may say that let's purchase a particular thing today because it's needed. Tomorrow, the pandemic has changed, and you may not need it that much, and you may need something new. So you must be willing there to say, okay, now we don't need this. We need to allocate more on this area, whether it be some drug, whether it be some testing equipment. You may need to say that we need to focus a lot on, let's say, RT-PCR testing. But then when you have a rapid antigen testing kit available, you can say now the demand for the RT-PCR testing has come down. Let's look at resources somewhere else. So that type of evolving process is very important. And I think that is where you have to be really in touch with what is the ground reality, and also be able to see how are things going to evolve in the very near future, so that you can evolve your resources in that manner.
Dr. Guleria, our healthcare system in India is quite highly regarded internationally, and we get a lot of medical tourism. But I'm interested to know from you, in your engagement with the WHO and the CDC, what are some of the international best practices we can still use in India, even though we are at a very good level? But what are some of those? What are some of the ideas we can use here, which will be context specific, but also help us become more efficient, medically speaking?
So I think one must first accept the fact that we are different and we have to develop our own strategy, because our population is large, our resources are limited, and we have to look at how we can do. And I think we have to also see how we can innovate frugally in a more cost effective manner, because sometimes when you look at resources in the Western world, they are much more than what we have here. And the type of population that we are handling is something that they are not even able to sort of comprehend. But yes, we need to develop strategies where we are able to use technology in a better way. We need to develop strategies where our surveillance system is better, and where there is a lot of crosstalk between different groups. So you have people who do a testing and are able to pick up, let's say, a new outbreak or a mutation in a virus, but they have to be able to very quickly and very easily crosstalk with, let's say, people who are doing the clinical monitoring or the epidemiological monitoring. So it's like saying the lab and the hospital and the patient, the doctors have to be able to communicate very well, so that you understand the clinical epidemiological link. Sometimes we have the data, but we're not able to link all the dots or connect all the dots. And that's why sometimes it's a delay in the response. The pandemic is not going to wait for you to respond. You have to have all the data as early as possible so as to make these decisions. That, I think, is very, very important. We also need to see how we can strengthen our public health system in a bigger way, and also have a lot of good, let's say, testing available at different regions of the country for new infections which may come out, outbreaks which can happen. And what we already have is we can strengthen what is known as a rapid response team and program, so that our response becomes much more rapid. That is something that we need to develop for our own country, because our challenges are different. How do we reach out in remote areas? How can we develop strategies where things are better for us in keeping our resources in mind?
Dr. Guleria, there is another pandemic, silent one, which is a mental health crisis, which is not addressed, in my view, enough. And since your talk today is heard across the government system at the highest levels, leaders are very often struggling with issues of mental health of their staff, of people they supervise, and sometimes even themselves in the process of leading. So let's take healthcare workers. What can be done to ensure that they really are provided all that they need to have a mentally stable condition in order to do their work? And how, generally speaking, should we address this mental health crisis?
So I think mental health crisis is a huge crisis. You're right. It's almost like a pandemic or an epidemic. And COVID actually further pushed it and made us realize how important it is, because of the lockdown, isolation, fear. The mental health issues actually became much more. And it became a big challenge addressing these issues, because there is a stigma in our country attached to mental health, which we need to overcome. There's also an issue of lack of availability of experts who can really address and help individuals. And we need to develop a strategy of how do we reach out to people who have mental health issues, rather than waiting for them to reach out to experts for issues that they are facing. So, strategy of how to can we use even, let's say, telemedicine, teleconsultation, social media to really reach out to healthcare workers and others who at times have mental health issues and are not able to express them. We also need to see how can we improve our environment in terms of being cognizant of the fact that any environment where we work can create mental health issues because of individuals' own perception. And therefore, how do we make a good balance between the work environment and de-stressing issues? So I personally feel that, we've become very much involved in our activities without the social activity that we used to have in the past, like get-togethers, going out. Uh, there was be time that even departments and healthcare workers would go out for picnics, for that matter, or be able to really sit in the evening and de-stress themselves. Our work pressures have become so much, and because of, I would say, the internet, because of social media, because of television, we've become more and more isolated rather than being able to communicate with others, and that has also led to a strain. So how do we break that in terms of building more social interaction, which is more physical rather than virtual, is I think what we need to do. And that is, I think, something which all institutes, departments, areas, even both in the public sector and private sector need to develop strategies, because it's something often we just push under the carpet. We must accept that this is there and we must try and find solutions and not wait for it to happen, and then someone does something which creates a big issue in the organization. You should be able to anticipate that and develop strategies that you are able to develop a better environment to decrease mental health issues. I personally feel that will also help to improve your productivity.
No, I think you're so right. We haven't paid enough attention to it. Just on the point of social media, we alluded to it earlier. Have there been discussions in the medical fraternity on the use of social media and how best to make it efficient were a crisis or a health emergency to come again, which, as we have established, is inevitable? Has there been any discussion on what is the most positive ways to use social media so that misinformation is at least controlled, if not totally removed from platforms?
Well, I think there needs to be more discussion because social media is evolving and you need to see how you can get the younger generation into it, because it's something that is has to be in tune with what is happening now. And secondly, one has to see how do we develop strategies of counteracting the negativity which happens in social media. One tried to do that a lot during COVID-19, and there was a lot of effort from various institutions, departments, and people to see how one could counteract the negative effect that social media is happening and build a positive environment, both in terms of fighting the pandemic, in terms of feeling that you will get out of it, and also countering a lot of misinformation which came from outside about how India was handling the pandemic and how we were doing. So that was a lot of uh, action was required. But I feel that as we move forward, we need to work on that and build it up into a strong, robust platform so that in the future also we are right off the block early rather than being more defensive and trying to counteract things. We sort of take these challenges early and are able to turn it around so that it becomes more positive for us rather than trying to counteract the negativity that arises in social media and then we are sort of firefighting. I think we need to develop strategies so that we are aggressively addressing it right from the beginning rather than later on.
No, that's very true. Dr. Guleria, you and I met when we were evaluating medical education some years back and how to introduce non-medical therapies into with patients. So on the medical education questions and the curriculum and all that is given to medical students, what needs to be tweaked or changed in the medical education to better prepare for medical health emergencies?
So two things. One is medical education needs a regular change in the curriculum because the we are living through a revolution, and science and medicine is changing rapidly every year. We're having new therapies which are coming in. We talk of artificial intelligence, we talk of big data analysis, gene editing, we talk of CRISPR-Cas technology. So all of that needs to start entering into the curriculum, which sometimes is not in tune with the new things which are happening. At the same time, we must remember that medicine is both a science and an art. So the art of medicine, the empathy that one has to have when you look after patients, when the communication skills, all also need to come in a big way in the curriculum. And of course, like we all said, issues of how do you decrease or de-stress yourself. So one is that we need to look at a curriculum in a more holistic manner in trying to see how we can stay in touch with the needs of the country and the changing knowledge that is happening as far as medicine is concerned. How can we make the curriculum better in tune with the doctors for the future who are going to be managing the health system? At the same time, I think we should now sort of accept the fact that health and medicine and science is now moving out of silos. So healthcare is not going to be like what it was in the past. You will have to have a lot of multidisciplinary interaction. So I, for one, feel that we should start looking at health with elective subjects as far as medical education is concerned. If someone wants to take an elective in alternate medicine, wants to look at yoga, Ayurveda, he should be allowed to do that so that he develops a more holistic approach in terms of managing medicine. If someone wants to look at biomedical engineering, he should be able to take a course on engineering so that he can look at biomedical engineering, maybe start a startup or start something in terms of innovation. If someone wants to look at humanities, so medicine needs to start looking at things like, because now science is looking at, even in medicine, we now look at wearable devices, we look at artificial intelligence. So medicine as it was 20, 30 years ago in just sort of straight jacketed is now becoming more and more sort of this merging of various specialities, and keeping that in mind, medical education has to evolve in that manner. So that I think is also very, very important. And also education as far as public health is concerned, in terms of awareness of how do we look at outbreaks, how do we manage pandemics, what is the containment strategies, also needs to build in. It's a big task, but I think there has to be a sort of a constant re-evaluation of how do we educate the medical students of today.
Yeah, you mentioned the youth, and I think all of us now have reached a stage in our lives where we have responsibility for training the next generation. They observe us, they follow our every move, they see what they like and what they would do differently. What advice would you have, Dr. Guleria, for young public health professionals who are now being trained? What advice would you have in their training in emergency preparedness? And what are the things they have to think about today, which may have not been relevant 20, 30 years ago?
So I think one issue that the public health people need to realize is that we are now getting technology into the health system very rapidly. So in public health, how can they use technology in staying in touch with patients? That is one important thing. Second important thing to remember is that the burden of disease is shifting more and more towards non-communicable diseases. So in an outbreak, how do we protect those who are having comorbidities, and how do we increase their awareness of what they should do? So initially, we had a whole burden of infant mortality, maternal mortality, infections, hepatitis, TB was a big thing, which is now coming down. Now we're looking at more cancers, diabetes, hypertension, strokes, heart disease, chronic respiratory disease. So public health policies also have to now look at how we can factor all of this into the management of an outbreak, where you will have this group which is going to be more vulnerable to the morbidity and mortality of any outbreak. So how do we educate them in terms of controlling the underlying diseases that they have, which predispose them to having more severe illnesses when there's an outbreak? And at the same time, how do we reach out to them to make sure that they are protected? And how can we use technology to be able to monitor them, be able to provide good public health, not only education, but also to some extent uh, treatment and observation. And surveillance systems also in public health need to be strengthened. How can we look at surveillance so that any outbreak which occurs even in a remote area can be picked up by public health experts in that area quickly, and they can start a containment strategy which will help in preventing that from spreading to other parts of the country. So a lot of newer innovations need to come in.
Dr. Guleria, this session is on leadership during a health emergency. And I want to now make you uncomfortable and put the microscope on you as a leader, because the nation has watched you during COVID. And now, of course, you're again doing cutting edge policy work in Medanta. So, you're from the hills, you have a very calm temperament, but here in Mission Karmayogi, we are, among other things, focusing on building leadership in our civil service, which is empathic, which is futuristic, which is in many ways a break from the past, where discipline, hierarchy, strictness, those are not the only parameters. So I want to ask you about you as a leader. You had the nation's attention on you. Every minute, it was a critical minute. And you had to make multiple decisions. Some perhaps accepted, and some your people around you must have felt that, you could have decided differently, which happens to every leader. So how do you today see yourself? You have possibly seen yourself in every situation. So for you, leadership, what is a temperament for leader which really guarantees the success of an entire tribe, an entire community? And what should leaders, especially leaders we are training of the future, be thinking about when they plan for both things which are an emergency, but even routine work? How do we train a really solid group of future leaders?
That's a difficult question. I think the first important thing is that you should have confidence in yourself and faith that what you're doing is something that is for the for society, for what your work demands out of you. Secondly, I think you have to realize that for any leader, it's very important to have a good team. So you should be able to have good people to work for you, and those people don't have to follow any hierarchy. Sometimes you may have someone who is very good, but maybe not the top person in your organization. He may be at a middle level or even at a junior level, but his skills are such that they can make a big difference. So therefore, you have to be able to see that you have a good team where you have individuals who are dedicated, can deliver, and are honest. The issue is that you must have people who are not there to just please you, but are there to be your critics also, and can also tell you that this is they feel is not right, and you need to then take a balanced decision, and should be open to criticism and to be able to accept what others are saying. It's not that what I say is always right. You may be wrong, and if you listen to everyone, you may be able to really find a better solution to a problem. That I think is very, very important. At the same time, when you have made a decision, it's important to be firm about it. You should not look that you're sort of swaying in your decision, and therefore you take one decision today and you change it tomorrow because of someone else's influence. So you should be able to justify what you're doing, have faith in what you're doing, and then take it forward to its logical end. But I think it's important to really be able to take your team together. It's for any leader to be successful, it's all a teamwork. You have to get everyone involved. And I somehow feel that it's even people at a lower level who are as important as people at a higher level. You must be able to get everyone involved. So if you're, for example, in the hospital, it's not only the faculty, it's the nursing staff, it's the technicians, it's at times even the security guard. They will tell you something which the others have not looked at from a different point of view. And sometimes for us, it's important to ask the patient's attendants also. They will tell you something which you have not looked at. And this is what I said, I realized in the morning meetings that I used to have every day, that people from different areas would come up and give you not only problems, but also solutions. That, we find that this is happening in the institute during the outbreak. What should we do? And someone will come out with a solution. So you have to, it's true that you will not be able to find solution for everything and you will not be able to satisfy everyone. And someone will always have some degree of nuisance value also. But you have to accept that when you are trying to get things done in a pandemic, and you can also, and in an outbreak, there's always the fear of the unknown and a panic situation, which you have to sort of try and put a calming effect on, because it's very important that people have that faith in you and also believe that what you're doing is for everyone's good, and then they will actually will follow you when when you have to implement the decision that you've made. So it's not only the decision, but having that trust in people that they will implement the decision that you've made, that this is the right one that is being done. So I think those are factors which become very important in an outbreak.
Thank you, Dr. Guleria. As always, most inspiring to talk to you, to learn from you.
Thank you.
And we hope that you will come back and be with us again. So thank you very much today for your time, and thank you to the audience for being here with us, and wish everybody a wonderful day. Thank you very much.
Thank you very much for having me. Thank you very much.